Say Goodbye. Beautiful song. And I want to look at Time to Say Goodbye in relation to diabetes and identity. Now, for someone living with diabetes, the journey is marked not just by medical routines, medication, and so on, but by how we see ourselves through the lenses of age, race, and gender, because often we are told at the point of diagnosis that diabetes is important because of these elements: age, because of gender, because of ethnicity. And it is. But sometimes we can therefore come away with the impression that this is what defines us. And this should not be the case. This is what makes you unique in terms of an individual. And it is then up to us as doctors to ensure that you are getting the best quality of care. So let's let go of these limitations, embrace them as individual characteristics of which you should be very proud, but also take advantage of what there is out there. So let's just break this down, because, as I say, when you hear about the fact that age or biological sex or ethnicity is affecting your course through diabetes, it can feel a little bit dispiriting. But when we turn this around, we need to first look at the evidence. The evidence tells us that yes, age is important. Do you know, if you develop diabetes as a young person, I'm talking about someone developing type 2 diabetes as a teenager, or in their 20s or early 30s. Now we're seeing more and more people developing diabetes at these young ages as opposed to middle age, where historically was the case. So if you develop diabetes as a young person, your future risk, unfortunately, of complications actually exceeds, it's greater than that of someone your parents' age developing diabetes in their 40s or 50s. But that's not just it with diabetes and age. Diabetes tends to become more common as people get older. And that is because of the cells producing insulin within the pancreas gradually wearing out. So diabetes is affecting people at a younger age, type 2 diabetes, and at an older age in different ways. In fact, there are now more people living with type 2 diabetes, young people diagnosed with type 2 diabetes, than living with type 1 diabetes, which historically was the commoner form of diabetes to see in people who are younger. Now, that's age. Let's now look at biological sex. If you develop diabetes as a woman, then you effectively lose what we call the hormonal protection, the protection that comes from estrogen before the menopause, that reduces your risk of cardiovascular disease. And this means that if a woman develops diabetes in her middle age, her cardiovascular risk is then multiplied, and it becomes 4 to 5 times that of a man of a similar age. And then if that wasn't enough, if someone is black, then if this person has yet to develop diabetes, their future risk, so my risk of developing diabetes as a black man, is going to be 2 to 3 times that of my white friend. If you are of South Asian extraction, that risk is then 3 to 5 times that of your white friend. So we can see that diabetes is not respectful of age, biological sex, or ethnicity. It's ageist, it's sexist, and it is effectively racist. But I'm being satirical now. I'm saying that these are what we call non-modifiable risk factors, and they are what make us unique. So we should not be seeing these as limitations. We should embrace them as individual characteristics. But furthermore, we do know that diabetes has undergone so much change in the way of drug development, pharmacological development, of service development and diagnosis, that if you are working with your healthcare professional, you have the opportunity to actually level out these imbalances caused by your individuality, because we can now tailor treatment to actually suit your individual needs. So it's actually time not to just look at things in a very somber and limiting way, because that is restrictive. We should be saying goodbye to these restrictions and saying hello, welcome to new possibilities, because this is what it is all about. And this is not just a message for people living with diabetes, but also people from any walks of life, really, because letting go of limitations is really about accepting yourself for who you are. So I would actually say to you, what would you let go of? What would you shed? And in place of that embrace going forwards, put it down in the link below, or even journal it if that's better for you. But most importantly, let go of anything that is stereotyping you, anything that is shaming you, anything that is stigmatizing you, and embrace new possibilities. Say goodbye to the old and welcome the new you.